Health officials across the country are urging parents to vaccinate their children against measles. That's as cases grow, especially noticeable in South Carolina, where an outbreak has infected more than 550 people.
You may remember last year, the country saw the worst spread in deaths from the measles since 1991. Through preventable vaccines, the measles had previously been considered eliminated from the United States since 2000, but now is at risk of losing that.
So I spoke with Michigan health officials about what this means for your family.
This year, we haven't had cases of measles in our state yet, but they're coming. It's inevitable.
That's Dr. Natasha Bagdasarian, Michigan's chief medical officer.
It's so contagious that it can hang around in the air for hours after a person has left a room. So you can actually be exposed to measles by someone who left a room 2 hours before you entered that room.
She explains measles is not just a rash. Its symptoms can be devastating for those very young, and babies typically don't get the MMR vaccine until age 1.
So about 20% of kids with measles will end up being hospitalized.
Measles symptoms include a rash, high fever, seizures, cough, and conjunctivitis. But it also severely lowers your immune system and can lead to pneumonia, swelling around your brain, or even death.
One of the things that's really frustrating for me as a physician is I know the benefit that vaccines provide to our communities. There are a lot of folks out there who haven't seen a case of measles in real life. I've seen patients with measles and taken care of this. I know how bad it can be.
So let's talk about those vaccines. The MMR vaccine is 97% effective at preventing measles. However, routine childhood vaccination rates, including MMR, have decreased significantly over recent years.
In 2017, we were at about 75% of our little ones vaccinated against those routine diseases. That number has declined from 75% down to 68%.
Even more concerning to Dr. Bagdasarian is looking at vaccination rates at a county or even school level.
And we've got schools with 40% of their students vaccinated. So if we see a single measles case in one of those low vaccination schools, it could result in a huge outbreak.
According to 2024 data from the state, kindergarten vaccination waiver records for Kent County are some of the lowest in the state, meaning more kids are vaccinated, which seems promising. But Dr. Kristen Oldenburg, the medical director for Kent County, says it's all about perspective.
It still really doesn't meet the rate of immunizations that we need for herd immunity. So really for herd immunity, we need about a 95% immunity rate, or immunization rate, and we don't have that.
Dr. Bagdasarian says while seeing the decline in vaccination rates is frustrating for a physician, people do need to have honest conversations about vaccines and science.
But I also have to understand that people are coming from a place where there's a lot of questions right now. People have doubts, and we've got to be able to have conversations about vaccines where we're talking about the science and the data behind vaccines and not making this a political conversation, because this is not at all political. This is just purely a medical issue, a scientific issue, and we've got to treat it as such.
And Dr. Bagdasarian also urges all adults to check their vaccination records, especially before spring break travel. This is especially true for those born prior to 1989, as only 1 dose versus 2 was recommended back then.
You can get the MMR vaccine at any health department, pharmacy, or doctor's office.